I'd like to talk to you about team dynamics and stress. We all know that the medical team is really important for good patient outcomes. During this COVID pandemic, however, medical teams have to work differently. The team structure has been changed. In many cases, teams now are ward-based rather than consultant-based. Feedback for team members is different than it might have been under conventional working circumstances. There's a lot of evidence to show that when teams work well together, clinical outcomes and team members have better health and well-being. Michael West is a behavioural psychologist working in the University of Lancaster, and he's done a considerable amount of work with the King's Fund. And this, some of his work demonstrates that clinical outcomes in terms of morbidity and mortality are better when you have well-functioning medical teams. And also team well-being is improved with not only the physical and mental health of each of the individual members being improved, but also the collective well-being and performance is also improved. We all understand how medical teams have difficulties because it's often a stressful environment. Well-functioning teams have a unified purpose, they have clear objectives, the roles and responsibilities of each of the different team members are well delineated. Decision making is collective and input is sought from each of the team members. Communication is clearly important, and this allows discussion for input from each individual, and this gives rise to a collective decision making, which is clearly important. Because we all understand that not all team members are there at any one time. So the communication that we see being passed down from different team members is clearly vital. And it also brings to mind the importance of leadership. Who is the team leader? The team leader may change on occasion. Frequently it is the hospital consultant in a hospital setting, but if the consultant isn't there, who is the team leader who makes decisions and communicates those to other staff members and to the patients? Now recently I became concerned about the team dynamics, having spoken to some of our interns during this COVID pandemic period. Clearly the team structure has changed completely since the COVID pandemic started. In many circumstances, in many of our hospitals, teams are now ward-based and not unified in the same way. In many cases, lots of team members change frequently because of self-isolation or being off sick. So it's really important that we try and minimize the stress that doctors working in these teams experience. Many of our young doctors are tired. They find the circumstances they find themselves in stressful. They are carrying out roles that previously they may not have carried out. And in many cases, they've had little consultant contact. At a social level, many of our young doctors have to self-isolate at home because they cannot live with their families because of the risk of passing on the COVID virus. And for many of them, there is no end in sight. They understand that it's going to be like this for a considerable time to come. And some of these interns have said to me they've had very little contact from consultants. Nobody's asked them how they are or how they're managing or what their home circumstances are. And I think this is inappropriate. I think we have a greater responsibility to inquire and support the welfare of those who work on our teams. Now, there's also lots of work carried out demonstrating that tiredness and lack of sleep impacts quite severely on staff morale in the medical environment. And I would have concerns that the trauma experienced by some of our young doctors may be long-lasting. Stress as a consequence of adverse clinical outcomes can lead to chronic anxiety and depression. And I think there's an onus on us all, particularly now that in the coming weeks we will have a whole cohort of new interns entering our workforce, and I think the onus is on all of us to support them appropriately, take a personal interest in their well-being, and despite the fact that our team structure may be different, it is important that we make contact with the various team members, interns, SHOs and registrars. And despite the fact that our team structures may be different, there's still no reason why we cannot have weekly meetings, educational opportunities, either webinared or video conference or in person with the appropriate social distancing. We could all engage in sports rounds, for instance, where we talk about the difficult challenges that various team members may have experienced. So I would urge all of you to support our young doctors, particularly the new interns who are going to be on our wards in the next week or two. Thank you.